conditions, and namely to help you maybe discontinue some of the opioids or other medications to use like a safer plant material. So that's kind of the emphasis. First, I want to tell you something about myself. I'm Dr. Chang. I started my training as a pathologist, board certified in anatomic and clinical pathology. And I worked as a staff pathologist for many years in San Francisco, St. Luke's. Then I joined my family business for a while in the nutritional supplement business. And I was vice president of the quality control program there. And actually the experience there, I think can seep pretty well into the cannabis industry currently. But anyways, starting in 2012, I'm a certified practitioner of functional medicine. And then for the last 5 years, I've been doing kind of a hybrid practice of primary care, functional medicine, and medical cannabis evaluations. And then earlier this year, I really felt a strong calling to just concentrate on functional medicine because it's really the future of medicine in many respects, because the traditional medicine system is breaking apart. And as you can tell from the from the Congress inability to make any consensus on that whole topic, I think it's a reflection of the very deep-rooted issues in that is more like a 19th century model. And functional medicine will be introduced is like a 21st century model in a way, because it really looks at the individual as a whole. So it's a personalized medicine, and it's predictive of the conditions that you will develop or on the way to developing. And so we want to treat it early and just change the whole course of your illness. And I think that's another area that conventional medicine kind of ignores. They want to wait until you have the full-blown disease already. Then they just want to give you a pill for the rest of your life. Whereas we have tremendous amount of research in nutrition now that shows, food and your lifestyle changes can directly affect your genome, turn off or turn on the right genes. And so even if you have a genetic predisposition for Alzheimer's, for example, or many other conditions, we can override that with foods and lifestyle. And that's tremendous. So everything's very scientifically based, and that excited me to really go into the field. And also I became a gluten specialist this year. And as it turns out, I'm gluten sensitive, and this is another area that's often neglected. But anyways, let's talk about the endocannabinoid system. I don't want to get too scientific here, but this is for general public. And the thing to understand about this system, this was discovered only in 1992 by Meshulam in Israel. And basically, we have the endocannabinoid system within ourselves. And the function is just beginning to be known. But we have endocannabinoids that mimic THC. It's an anandamide, and then another that mimics the CBD, AG2. So that's all produced in our own bodies. And what this system does is pretty much for homeostasis or balance of many different things, from the brain function to your moods, to your thinking, to your digestion, reproduction, also development in utero. So it plays a role in many, many different functions, and we're, I think, only beginning to tap into how the whole thing works. But again, it's what's marvelous. This system really parallels the way the cannabis works. There are some agonists in the system that excites, and that will be similar to the THC that energizes, and others in the system will be more like CBD. It kind of calms the system. So the two always remains in balance. And now we have studies that show that many of our illnesses, particularly body pain like fibromyalgia, irritable bowel, IBS, and migraines. Many of those represent a deficiency in the endocannabinoid system. And this is definitely one area where medical cannabis can play a role. But anyways, this just kind of shows that there are different, molecules that fit into certain receptors on the nervous system that turn on and off. So basically, the system is like a neurotransmitter system of the body. And this kind of explains how the endocannabinoids as well as cannabis can affect so many different functions of the body. And that kind of is similar to functional medicine because we deal with multi-system disorders. So if you go to your conventional doctor and you complain of stomach pain, they'll just send you to a specialist just for the gut. Whereas you really want to look at, everything else in the whole body, from mind, body, and spirit. So, anyways, this is again a more detailed view that shows how this, the endocannabinoids will affect the immune system and plays a significant role in the immunity, keeping our body strong and healthy in the immune system. This just shows the multiple organs. The CB1 receptors are mainly in the central and peripheral nervous system, but certainly many others, from the lungs to the muscles, GI tract, and CB2 mainly in the internal organs, spleen, bones, skin, and also in the immune system. And then other systems have a combination of both receptors. So this explains why cannabis can affect so many different functions, so many conditions with one medication. So let's just go over some of the main ones. The main cannabinoids. The cannabinoid is really a family of over 400 different compounds. And we only know a few of these. And most people know about THC because people think this is one that gives you the head high. Well, it does that, but then it also does a lot of other functions. So THC has been kind of demonized by the public because they think they don't want to get high, but they want the body effects. But THC actually does have a lot of the body effect, the pain, nausea, very good for that. Stimulates your appetite. It's also anti-inflammatory, antioxidants, and elevates the mood. And the other one is cannabidiol, CBD. This has been painted as the kind of the good guy in the whole system, the one for all the medical effects. But again, it's all about balance, You can't just isolate one and say, I want that effect. It's really a balance of all these 400 some different chemicals in the plant. So CBD, again, very good for pain, inflammation, antioxidant, antispasmodic, relieves muscle spasms, anxiety, and nerve protection. So it's very good for neuropathy, for example. And then there's a third category of called terpenoids, which are often not talked about, but this is a family of volatile aromatic oils that gives the fragrance to the plant. So the smell or the bouquet of the cannabis comes from the terpenoids, and the profile or the smell differs from strain to strain. And a general rule is you need to smell it, and if it smells good to you, that's probably the one that your nose knows. So choose one that's appealing to you. Terpenoids are generally non-psychoactive and works in conjunction with CBD on the CB2 receptors, and they both modulate the psychoactive effect of the THC. So again, there's that check and balance system in play. Other terpenoids include pinene, which is from pine oil, and this is a great bronchodilator. So asthmatics, for example, can really benefit from this. It's good for reflux. Another terpenoid is called limonene. That's the smell from lemon oil. This is good for convulsions, anti-cancer, antimicrobials. Another category is called linalool, which is found in lavender. So as you know, lavender is really good for anti-anxiety, anti-depression, uplifts your mood, as well as you can use it for various skin conditions. And another category is the beta-caryophyllene, found in many herbs and vegetables. And this is really good for anti-inflammatory for autoimmune diseases. So as you can see, this plant shares many of these essential oils that are found in other plants that have a lot of beneficial effects. Okay, I think this slide, the old classification of the sativa versus indica has been found to be not so useful anymore. It's kind of an outdated concept because the strains have been so hybridized nowadays. You really don't know, they're like all, all mixed together. But I guess in the original strain, in ancient days, this was the original strain of cannabis found in India, Middle East area, was the sativa. And people associate this mainly with the head high, energizing, uplifting the moods, preferred for daytime. And again, the prominent cannabinoid was the THC. And then versus the indica, more considered a body effect for pain, inflammation, muscle spasm, nerve injury, anxiety, insomnia, general relaxation, sleep. And again, nowadays, most of these strains will have a combination of CBD and THC. So it's not as helpful to talk about the botanical strain unless you're like a grower. And because nowadays most of the strains are some form of hybrid. And so these are genetic combinations of the strains where the medical effects are combined and balanced. And I personally feel the hybrid is the way to kind of start out anyways if you're a new user, because the negative effects of the pure strains are kind of like counterbalanced by each other. And that gets to that balancing system again. So these hybrids retain the elements of their sativa and indica ancestors and varying levels of THC, CBD, and other cannabinoids. And the dispensary, they can help you choose the right strain. It's really much more useful to talk about the ratios of the THC to CBD rather than the botanical strain, because that gives you a better idea of the effect of the medication. So I kind of recommend starting with a 1-to-1 blend of THC to CBD until you see which cannabinoid system you need more. And again, all that is achieved through trial and error until you find that therapeutic level and the right strain that fits you. The thing to note with these strains is cannabis is not a one plant that fits all people, all conditions. I mean, there's just really no such thing, even though people might want to make it that way. But you need to, just like functional medicine, you need to individualize it for your endocannabinoid system and find your deficiency and the right strain to fill that deficiency, so to speak, until you return to that balance. And it's important to talk about this entourage effect. I alluded to this, but the definition here is that it's the interaction of over 400 compounds in the whole plant that leads to a synergistic effect that magnifies the therapeutic effects to a greater level than the individual ones. So that's why we really don't want pharmaceuticals to come in and start, just picking one single cannabinoid, THC or CBD, and say, and make that into like a drug, because you're missing out on all the other hundreds of, compounds that work synergistically to increase the effectiveness. So one example is like the pharmaceutical called Marinol, which is often given to cancer patients on chemotherapy for nausea. And it may work, but it's very limited in its effect. And so whole plant therapy is always better than extracts or isolated compounds. And then another concept is that THC should not be demonized for its psychoactive effect, because many of the illnesses, especially when you have pain, you have a depression, anxiety, depression associated with the pain. So it's not just pain by itself. There's also a psychological component to it. So THC can really help with that, and just kind of uplifts the mood. So you deal with the pain better, so to speak. And so again, this is all needs to be individualized according to your own, how people react to it. People react quite differently. Some just can't stand the least psychoactive. Others feel it just kind of relaxes them and helps with the pain. So, and then CBD effects are often potentiated by THC. One example is in children with epilepsy. They found that a small amount of THC can really, work better than just pure CBD. And another example would be like in cancer. They found that people want to use CBDs for cancer, and it is effective, but THC is the one that actually kills off the cancer cells, what we call apoptosis, and then CBD comes in and prevents the spread of cancer. So again, working in conjunction is often better than alone. So just keep an open mind as to what strain you use, and you have to kind of figure out for yourself based on how you feel. And so CBD, again, we mentioned this earlier, blunts the psychoactive effect of THC. And that's a general principle in all plants too, and botanicals. I mean, it's more than just one isolated compound, and it's the whole myriad of compounds that work together. That's the miracle of plants. And again, it parallels functional medicine. Instead of just taking one pharmaceutical that may treat one pathway in your metabolism or pain pathway, you're by using plants, you can really do a lot more than just treat that one specific pathway. Because if you block one pathway, often the body, you have side effects from that. Whereas the plants can treat the whole person because of these myriads of compounds and the entourage effect. So just a word about dosing. Less is more, so you always want to start with the very lowest dose possible, and then build up slowly and very gradually. Also, you use cannabis over time may result in some tolerance, so your dose increases, and so you need to watch that. You take a tolerance break to allow the body to kind of restore itself. The receptors are actually sensitive to the amount that you use. So if you use a lot, the receptors will actually decrease. And then if you take a little break, the receptors will normalize or stabilize. So the general idea here is to discontinue the cannabis for 1 to 2 weeks every 3 months if possible. Obviously you have to find a good time for that. And or 1 day per week, like on a Sunday, when things are fairly chill. And that way you allow the receptors to reset, so you don't build up the tolerance. Another thing with the dosing, if you're trying to get off of prescription medications, you don't want to be, doing both at the same time. It may be too much, so you want to start out, on the weekend when you're not doing anything particular, and you don't want to be alone. Well, you want somebody to kind of watch how you react, because you may not be aware of how you're reacting. So that's the best way to start out if you're totally new to this cannabis.
What do you mean by dosing?
Dosing is, the amount to use.
So, can you be more specific?
Well, I always start very low, like 1 to 2 milligram level, but individual tolerance level, individual therapeutic level can be very wide. So you know how people are very sensitive to even like one aspirin and stuff, or others can take half the bottle and not feel it. So it depends on your.
Medicine, we have a peak and throw. What is the peak?
Well, for CBDs is actually pretty much a continuous line, and it does not cause really bad effects until very, very high. So the therapeutic range is much wider than conventional medications. And they're generally not necessarily a bell shape. I mean, it's more like it just keeps going up. Of course, keep in mind there's never been any deaths related to cannabis, because it doesn't inhibit the respiratory center. So I don't think there's been any reported cases of deaths. And if you take a little too much, you just let it wear off on its own. It'll be metabolized within 8 or 12 hours. So yeah, go ahead. Sure, I love questions.
1 to 2 milligrams for adults, or what about for children?
I would start, even for children. I generally don't prescribe to children. But for adults,
I've seen nowadays.
Yeah.
They would put it in on the baking stuff, like brownies.
Yeah.
For the kids.
Yeah. The thing with those is it's kind of unpredictable, the dosing in edibles. So, but the principle is always start with a very minute amount. And the whole labeling issue is also very complicated, especially with those edibles. They may say the whole dose, like a chocolate bar, is 180 milligram. So if you want to start low, I mean, it may be kind of hard to to cut it into that small of a piece. But the main idea is you start very low, and then you wait at least an hour or two, especially with those edibles, because it takes a little while to kick in, depending on what's in your stomach. And so we'll go into the, oops. Okay, so this talks about some of these delivery methods. Most people obviously have, or think of cannabis as smoking it, but that's the least healthy way, and I generally don't recommend that, although there may be a point to using a vaporizer through a vape pen or a tabletop type of vaporizer, because it is the fastest within minutes. And vaporizer is a lot cleaner than just smoking it, because smoking you have, very much similar to a cigarette. You have all the burn effects of the paper and other things. And but there are so many other ways to use it. I personally like these tinctures, which are concentrated extract in an oil, and you apply it sublingually, and it's fairly easy to control. You can use a dropper, so start with 1 drop. But again, it has to be labeled as to how much it is. Hopefully they'll say milligrams per milliliter, and so you can figure out from that, you know, how much you're getting per drop. But then again, the labeling could be kind of all over the place. So, but at least it's controllable versus the edibles, which are the cookies, brownies, candies. Dosing is definitely a concern here. Start with the smallest amount, and the effect could be delayed. And you need to know, you know, what the total concentration of cannabis is in this whole you know, edible, and so you can divide it properly. But many people, including cancers, can respond with just you know, a few milligrams. So it does not have to be. I mean, and that's another myth where people say it's got to, you know, you shoot for the Rick Simpson oil type of thing at a gram a day. You know, many people can't tolerate the side effects of that. So so you just have to see. I know cases of even advanced cancers, you know, that have metastasized, and they just do 1 or 2 drops, you know, per day. So again, you have to find your own therapeutic range, and that way you can save money and not overuse it. So basically, let's say you start at 1 or 2 milligrams, then each day you add a milligram until you feel your symptom has diminished, and then you keep going, and then you feel some unpleasant effect, for example, and then you know you need to back off from there. So that's how you kind of find your therapeutic range. Again, it's trial and error, and you have to be aware of what you're using, aware of what you're feeling, maybe keep a little log, you know. So it takes some effort on the part of the users, but I think we need to preserve this this plant for people to use freely, you know, and not become a pharmaceutical, and then they're going to pretty much control the whole system, and they'll push the system as taking this pill, and you don't have to worry about it. But as for all plants, you know, this is the way to go. I mean, the effects are a little unpredictable. You got to find out how you react to it and how much you need to use for your particular symptoms. Then there's also the various teas, where it's infusing hot water with cannabis leaves. Topicals are great. These are ointments or salves for localized pain, joint pain, muscle pain, spasm. You just put it where you have pain, and it doesn't affect the mind at all. And then another option is the raw leaves. You can make that in a juice or smoothie. And this is powerful anti-inflammatory, antioxidant effects. So this could be, and the main active cannabinoid here in the raw plants are the CBDA and THCA